Welcome back to Preferred Medicare. I'm Holly Cohen, licensed independent broker, and today we're discussing an important topic that's been making waves in the healthcare world. Medicare Advantage is under fire, and we're going to break it all down, what that means for your health and your wallet. This is the first part of a two-part series based on an insightful article by Elizabeth O'Brien published in Barron's. So let's get started. Let's start with some background on Medicare Advantage, also known as Part C. This program manages Medicare coverage for over 30 million people in the United States. It's marketed as an all-in-one alternative to our traditional Medicare that we are offered from the federal government, often with enticing ads featuring celebrities like William Shatner, who, by the way, I got to meet once in my life. But there's more beneath the surface. Retirement consultant Marcia Mantell points out that these plans can lead to unexpectedly high out-of-pocket costs, and that switching back to traditional Medicare can be very difficult. This isn't something that you can just change on a whim. It's more like a 30-year decision when you're making that decision. So why are we hearing so much about Medicare Advantage lately? Well, there's several key reasons. Number one, financial pressures. Big players like Humana have reported sharply higher costs and lower profits. For instance, Humana's CEO Bruce Broussard mentioned that the industry might need to reprice plans next year due to unprecedented increases in medical costs. This could mean reduced benefits and more denials of service. Number two, healthcare providers' struggles. Some large hospital chains, as I've reported on this channel, have dropped Medicare Advantage due to lower payments and administrative burden. Cameron Regional Medical Center in Missouri had to cancel contracts with major insurers like Humana and Cigna due to financial strain. Hospitals are struggling with lower reimbursements and higher administrative burdens, leading to the closure of essential services. Number three, government scrutiny. The Biden administration is taking a closer look at Advantage plans, particularly their marketing practices, which might be misleading consumers. The administration is also investigating the industry practices that drive up costs, such as upcoding, where insurers inflate diagnoses to get higher payments. With all these pressures, consumers are caught in a growing battle among the government, healthcare providers, and insurers. As cost pressures rise in the Medicare market, it's becoming increasingly complex to choose the right plan. These decisions have long-term consequences for both your finances and for your health. Now, let's look at some statistics. Just over half of the eligible Medicare population is enrolled in a Medicare Advantage plan. These plans provide Part A hospital coverage, Part B outpatient coverage, and extras like vision, dental, and hearing, which aren't offered by traditional Medicare. The plans continue to attract new enrollees with a projected 7% increase in enrollment from 2023 to 2024. Despite their popularity, the economic landscape for Medicare Advantage is shifting. Rising healthcare costs, driven by factors like the pandemic and an aging population that's growing, are straining the ecosystem. For example, insurers are experiencing high utilization of healthcare services, leading to higher loss ratios. This is particularly evident as baby boomers continue to age, with about 11,200 people turning 65 every day in the United States. Humana covers over 5.8 million people within its Medicare Advantage plans. However, even they are feeling the squeeze. Their recent warnings about the need for disciplined pricing and potential benefit cuts highlights the challenges facing the industry. To wrap up, let's consider the immediate future. Current beneficiaries don't need to worry about changes just yet, as any adjustments to these Medicare Advantage plans won't take effect until 2025 at the earliest. However, those turning 65 and making the critical choice between Medicare Advantage and traditional Medicare, stakes are high. Switching from Medicare Advantage to traditional Medicare can be challenging, particularly if you want to add Medigap insurance to it, such as the Plan G. That's it for today's video. In the next part, we're going to dive deeper into the financial and practical differences between Medicare Advantage and traditional Medicare, and how to make the best choice for your specific situation. If you found this information helpful, don't forget to hit the like, subscribe, and please hit the notification bell. We're trying to keep you updated moving forward into 2025 so that you know what changes are coming your way. That's all for now. I am Holly Cohen, licensed independent broker, happy to share all of my knowledge with you. And as always, be well. And as always, be well.